Hello po muli. Pagpapatuloy po natin ang ating pulse diagnosis. Our topic is low pulse Chimay. Slow pulse. As described earlier, what is defined as slow pulse will be different from person to person. So, iba-iba po yung slow pulse sa bawat tao, sa bawat pasyente. A rule of thumb is that a pulse that is slower than 64 beats per minute is a slow pulse. There is cold. Tandaan po natin, syempre, pag slow, dahil sa lamig. Or deficient cold can be seen when there is yang deficiency. So, kung mababa po ang yang, slow pulse po ang ating mararamdaman. In which case, the pulse will be weak and slow. So, pag may deficient po, syempre weak. Deficient na may lamig, weak and slow. Pag excess cold naman po ang nagbablock sa yang and inhibits blood in its movement by contracting the vessels together. So when there is excess cold po na pumapasok sa katawan or nasa katawan na natin, the pulse will feel tight or confined. The depth of the pulse will give an indication of which aspect of the body the cold is located in. Natandaan po natin, pag ang cold ay nasa exterior pa lang, mas superficial po natin nararamdaman. Pero pag nasa deep na, kailangan nating idiin, pulso, nasa interior na ng katawan at ng mga organ na natin ang affected. So, slow pulse, pattern of imbalance, ito po ay due to cold. So, pulse description po, in olden times, the pulse was defined as slow in relation to the breathing cycles of the doctor. Noon po daw, ang pinagbabatayan, yung hininga ng doktor o kasi yung acupuncturist. Dapat healthy sila, no? Para normal yung breathing. Thus, a pulse was described as slow if the beat 3 times or less during the times it takes the doctor to breathe in and out. So, yun, pinagbabatayan nila yung hininga ng manggagamot. Noong unang panahon yun. It was described as rapid if the beat 5 times or more during the same time. Ibig sabihin po nun, kung ang hininga daw ng doktor ay less than 3, slow ang pulse. Pag more than 5, fast ang pulse ng pasyente. Obviously, this method relies on the doctor's being in a good health. Ito po yung sinasabi ko. Dapat ang manggagamot ay healthy para normal yung guide niyang breathing. Kasi kung hindi healthy, mamamali na. Kung fast pulse pala ay fast breathing pala yung doktor, adi mamamali na siya. So, it would not work if the doctor suffered from chronic breathlessness, although this method is not used any longer. So, the concentration on his or her own breathing focuses and relaxes the doctor's mind. Yan. In modern times, the definition of a slow or rapid pulse is related to the pulse rate, which must be correlated to the age of the patient as follows. So, according to age din po yung pagbilang natin. Ito, at least may guide po tayo ngayon, ano? So, pag 0 to 1, dapat po ang rate ay 120 over 140. Pag 1 to 3 years old, dapat po ang 100 of 110. Yan. Per minute po yan, 4 to 10 years old, 84 over 90. Yan. Hanggang 90 po 84 to 90 po per minute yung kanyang rate. 11 to 15, 78 to 80. 16 to 35, 76 per minute po. 36 to 50, 72 to 70. Pag 50 and above, dapat daw po ay 68. Yan po yung, sa bagay, iba-iba po yung librong ginagamit. At least kung ano po yung gagamitin ng lamp, yun po yung susundan natin. Any pulse rate below these values is a slow pulse. Of course, the values should not be adhered to rigidly. For example, a pulse rate of 74 in the 16 to 35 age range would be only very slightly slow and have no critical significance. So, paalala lang po doon, syempre bago tayo mag-pulse, kailangan napahinga nyo yung pasyente nyo, ha? Yan. So, description po ng slow pulse. The pulse beats less than 3 times per, sabi dito, yung practitioner breath, about 40 to 60 beats per minute, but with a regular rhythm. So, key points, pulse frequency is less than 3 beats per breath, less than 60 beats per minute. Yan po ang pulse image. Pag less than 60 po, slow. So, clinical significance, a slow pulse must also almost always indicates a cold pattern. Madali naman tandaan, basta slow, cold pattern po yan. A different interpretation of a slow pulse is that it denotes a problem in the yin organs. So, yin organs po yung may problem, as opposed to the rapid pulse, which indicates a problem in the yang organs. So, pag yang organs po, nagiging rapid. However, this is a broad generalization and not that clinically relevant. According to classic of difficulty po yan. Sinasabi, difficulties. Rapid pulse indicates a problem in the yang organs and the slow pulse problem in the yin organs. Karaniwan ang nag-slow ay yin and ang nagpapas ay yang. The clinical significance of the slow pulse depends on whether it is full or empty. Ang slow and full pulse, so nagsasabi po yun ng full cold. Tandaan po natin, pag full, ayan, may full cold. Whereas a slow and empty, syempre deficient po yun. Empty cold, deriving from yang deficiency. So ang ibig po sabihin, pag yang deficiency, mababa yung yang, mas mababa mula dun sa level ng normal. Kaya empty cold. A condition of full cold can last only a relative short time, a matter of weeks or months, because interior cold will be eventually endured yang. Yung mga matagal na po natin in-explain na pag matagal na yung lamig, i-consume niya yung init ng katawan niyo. Kaya ini-endure yung yang. So magkakaroon na po siya ng yang deficiency. Bababa na rin po yung yang ng ating katawan. Kaya magkakaroon po ng empty cold. Ibig sabihin po, yung cold mas mataas pero yung yang mas mababa kasi wala na sa normal level. So for this reason, in clinical practice, empty cold is more common than full cold because we generally see patient with chronic condition. Karaniwan daw po, mas empty cold na dun sa mga matatagal nang may sakit kasi nga na-consume na yung yang. Pag matatagal na ang sakit. If the pulse is very slow, beating only twice for its breath cycle, so it is called a harmful pulse. Medyo delikado na po yun. Dalawa na lang ang beats per breath. If it is beats only once per each breath, halos naghihingalo na to it is called the destroyed pulse. Both of these pulses, especially the latter, indicate extreme depletion of the internal organ and are always associated with serious condition. Isa-isang hinga na lang ito pag gano'n na ang pulso. Yan. Nire-repair na po natin yan sa doktor. Mga delikadong pulso na po yan. Sobrang bagal. So, common cold condition manifesting with a slow pulse. Common condition that present with a slow pulse are, pag meron po siyang stomach qi deficiency, spleen yang deficiency, heart yang deficiency, kidney yang deficiency, deficiency of gathering qi or yung zong qi. Naalala po natin yung zong qi. Reviewin po natin. Lung yang deficiency, cold in the stomach, cold in the uterus. Pag mayroon po mga abdominal masses or may cold phlegm and damp cold. Yan. Nakita niyo yung yang deficiency karamihan. Ibig sabihin, bumababa po ang yang kaya cold yung nararamdaman kaya mabagal ang pulso. A slow pulse in chronic condition may also indicates a deficiency of the original chi or yung U1 chi. Nagkukulang na po yung enerhiya na nakatagos dun sa ating kidney or yung ating U1 chi. So, contradictory manifestation characterized by slow pulse and heat symptoms. So, very occasionally, the slow pulse occurs in combination with heat symptoms. So, one of the reasons for this contradiction may be damp heat because the dampness itself may slow the pulse. So, yung pag may damp po kasi, pinababagal din niya yung daloy ng dugo. Kasi nagbabara-bara na yan dun sa ano eh. Kapag humalo siya yung dampness na yan sa flow, pababagalin niya. Of course, a contradiction between slow pulse and heat symptoms may simply due to the coexistence of cold and heat patterns. Yan. Halimbawa po dito, pag merong kidney yang deficiency, mababa po yung yang ng ating kidney with damp heat at meron siyang damp heat in the bladder is relatively common. So another possible common combination po kung kidney yang deficiency with liver yang rising. Ayun po, no? Parang minsan contradiction. Mababa yung yang, pero yung sa kabilang organ ay mataas yung yang. In menopausal women, a simultaneous deficiency of kidney yin and kidney yang is common. So if the kidney yang deficiency is more pronounced, the pulse may be slow. So kung mas matindi po yung pagbaba dun sa mga nag-menopause ng babae, kung mababa raw po, kung mabagal yung kanyang pulso, mas kidney yang deficiency siya. But the kidney yang deficiency will cause some empty heat sign, such as hot flashes and night sweating. So alam natin kung ano yung mga tutusukan natin, ano, kung ano yung palalakasin, yin ba or yang. Ayan po yung mga sign sa mamamagitan ng pulso. In the context of acute febrile disease of the warm disease type, the pulse can be slow with the pattern of damp heat at the defensive chi level. A slow pulse with heat symptoms may also indicate the condition of true cold and pulse heat. But this is quite rare. So, yet another possible explanation of a slow pulse with heat symptom is heat that is so intense it obstructs the circulation of chi and make the pulse slow. However, this is also quite rare. Meron akong ano. Situation giving rise to contradictory slow pulse and heat symptoms. So, damp heat, coexistence of cold and heat patterns, simultaneous deficiency of kidney yin and yang with predominance of the latter, damp heat of the defensive chi level, in warm disease through cold and pulse heat, so intense heat obstructing the circulation of chi. So yun po yung nagkakaroon ng mga slow pulse and heat symptoms. The slow pulse and jogging, yung pag nagjo-jogging, ano, yung mga nagjo-jogging, yung nag-slow pulse. According to Dr. Shen, relates sa slow pulse always to heart disharmony and poor circulation. Paradoxically, it is also often seen in people who jog a lot. According to Dr. Shen, excessive jogging, in his opinion, more than 4 miles a day lead to dilation of the blood vessel that eventually become permanent. Ganun po yung nangyayari. Thereby slowing the circulation so the pulse becomes slow. Nagkakaroon ng dilation of the blood vessel. Kaya nagiging slow yung pulse ng mga nag-jogging ng malalayo. Po yung explanation. Yung vessel na naapektuhan. A slow pulse is relatively common in Western patients who are joggers. Indeed, when we feel a slow pulse, the first question we should ask is whether the patient jogs regularly. However, this is not necessarily a false sign that should be discounted because it reflects the fact that excessive jogging induces yang and leads to internal cold. So yun nga, pag na-induce po kasi yung yang, bababa siya. So ang mas tataas yung yin. Yung pag bumaba yung yang, cold po yung mararamdaman kaya nag-slow. Therefore, although the slow pulse should be taken into consideration, so it is important also to bear in mind that it may be disguising the presence of heat. Situation that may cause a slow pulse without involving cold. O meron din daw po na walang cold pero nag-slow pulse. Ayan, syempre, kung old age na. Yan. Then after childbirth, pagkatapos mga anak, kasi syempre maraming dugo ang nawawala eh. Ano, mababa yung yin. Bumababa po yung chi and blood. Excessive consumption of hot and sweet food. A slow pulse also appears when a patient is on beta blockers, yung umiinom po ng mga gamot. In this case, it is a false sign and can be ignored. So, hindi natin nagagamit yung pagpulso kung may mga iniinom din na gamot. Kaya tinatanong po natin sa pasyente ha. Kaya napakalaga nung pag-interview natin sa pasyente. So, indication po yung cold syndrome. Kung may cold syndrome, meron po siyang slow and forceful or slow and forceless. Siyempre, cold accumulation, forceful po siya. Pag forceless deficiency, cold po yan. So, chi deficiency din. Biomedicine, intracranial hypertension, obstructive jaundice, rheumatic heart disease, viral myocarditis, coronary heart disease, and digitalis poisoning. So, pathogenesis po, cold causes contraction. When cold invades the body or a deficiency of yang produces cold. Siyempre, kung mababa yung yang, nagkakaroon po ng cold ang body. The chi and blood becomes stagnant. Hindi siya makakadali sa ating mga veins. Thus, the chi and blood circulation in the vessels slow down as the rate of the pulse. Babagal po yung pagdaloy. Gawa nung lamig. So, pag chi deficiency naman, chi commands the blood. And when the chi is deficient, the pulse will be moved slowly. Siyempre, kung konti yung chi, walang nagkukumand na, walang magpapadaloy, walang magpapadaloy ng maayos dun sa dugo sa ating veins kasi kulang siya eh. So remarks, the slow pulse is seen in some healthy persons, especially athletes or those who engage in daily physical labor. So, pwede rin pong sa healthy person makita siya. Combination po, slow and floating. So, nagsasabi po to na may pagpasok ng exterior wind cold with a prevalence of wind. Slow dip indicates interior cold, maybe full or empty, or whether the pulse is full or empty. Slow slippery denotes cold phlegm or damp cold. Slow choppy indicates blood deficiency and interior cold deriving from it. A slow slippery pulse indicates a pathology of chi, whereas a slow choppy pulse indicates pathology of blood. Ayun pa, no? Pag choppy, blood pa may problem. Pag slippery, ay chi. Ito, naranasan ko po itong nung isang araw. Galing kami sa pasyente eh. Nag-slow pulse talaga ako. Pumasok yung matinding lamig. Wind cold po. Slow pulse talaga. Pero nung binentusa ko, yun, madali naman siyang nawala. Bentusa at saka hot compress. Hindi ako nag-mock sa hot compress po yung ginamit ko. Pero ina-affect na po niya yung mga veins ko kasi talagang sumakit na. Ina-affect niya hanggang dun sa paghinga ko. Pero alam kong nasa vessel pa lang po siya kasi hindi ko na mararamdaman na masakit yung puso. Kundi yung mga veins papunta sa puso. Kaya nung binentusa po din, nare ko po dun sa side ng may pain. Yun, naramdaman ko talagang nawawala. Then hot compress. So, external wind cold na papasok sa katawan. Then pag slow weak po, denotes empty cold with yang deficiency. Yan. Mababa na po yung yang ng katawan natin. Slow and weak ang mararamdaman. Slow full, so denotes internal cold and is often seen in chronic painful condition. So mga chronic na po yan slow full. Slow wiry, so indicates accumulation of phlegm fluid or stagnation of cold in the liver channel. Kasi wiry, alam naman natin yung wiry, laging ina-affect niya ang ating liver channel, liver organ. Slow deep weak may indicate heart yang deficiency with symptoms of cold limbs. Di pa nauubos yung wind cold ko eh. Kailangan ko pang magmoksa uli. Cold feelings, sweating, and depression. So, slow tide overflowing indicates that the blood vessels are dilated in a young person. This is often due to excessive jogging. Whereas in the elderly, it may indicate hardening of the blood vessel. So pag matanda na, tumitigas po yung mga blood vessel kung nagkakaroon ng slow tight overflowing pulse. Mahirapan lang dumaan yung dugo. Kaya yun po, tight na yung nararamdaman. So yan po yung differentiation of similar pulses. Slowed down. This pulse has 4 beats per breath in cycle. Whereas the slow pulse has the 3 beats or fewer. So yung paano, pag less than 3 na, talagang slow down na siya. Slow down pulse. Pag moderate pulse naman po, yung description po nito, the pulse beats 4 times per practitioner's breath, faster than the slow pulse. So normal pulse, the pulse is vigorous with equal intervals, smoothly, and the same in all 3 positions. Nararamdaman natin yung normal. Pag morbid pulse naman po, the pulse is sluggish, its movement feels slow, it is just usually accompanied by other pulse qualities. So key points, feel slow to normal in rate when time. Other translation is slowed down, lax, retarded, leisurely. Yan po yung pulse image. So pag moderate, yan, nararamdaman mo sa 3 level siya, no? Yung pulse quality. Yan po, 60 to 90 beats per minute. So normal rate yan. Yan po yung image na moderate. So indication po niya, kung may dampness syndrome, spleen and stomach deficiency. So ang pathogenesis, kung dampness syndrome, dampness is sticky and easily collects in the vessel. Ay, malin po yun. Madali pong pumunta pala yung mga dampness na yan sa ating sa ating mga blood vessel. And then haharangan po niya yung daloy ng chi and blood. Then spleen and stomach deficiency. Spleen and stomach deficiency causes a retention of water and dampness. So remarks, if the moderate pulse is present in the patient who is suffering from a prolonged or critical disease, so it is a sign of the restoration of antipathogenic chi, nakaka-recover na. So magandang sign to Although this pulse indicates a pathology compared to a critical disease, it is still a positive sign. This pulse may also indicate a normal psychological pulse. So pag nagma-moderate na, matuwa na tayo kasi yung antipathogens chi ay nare-restore na. Next is knotted pulse. Review natin ulit. This pulse is slow and stop at irregular intervals, whereas the slow pulse is regular. So, kinumpare po ito sa knotted. Ang knotted paputol-putol. May pitik, mas mawawala. Pitik, 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 nawawala. Pitik, nawawala. Samantalang ang slow pulse po ay regular na pumipitik siya. Mabagal nga lang. So ito naman po is slow irregular pulse. So the pulse is slow with irregular miss beats. Yan, pagkakaano, mabagal na nga lang, nawawala-wala pa yung pitik. After the miss beats, the pulse immediately resume. So ang key points po niya is slow irregular pulses. Other translation natin, bound. Yan po yung pulse image. Pag pinatong nyo yung kamay nyo, makakaramdam kayo ng pitik o ng pitik. Ayan. Then, matagal na wala. Then, pipitik uli. Pipitik. Ayan. Tapos, less than 60 beats per minute. Or less than 4 beats per paghinga. So, indication, pag-excess syndrome due to stagnation, cold, tumor, or mass. Pag deficiency naman, deficiency syndrome, kung mayroon po siyang heart Chi deficiency. In biomedicine, ito po yung may mga sakit na coronary heart disease, yung may mga rheumatic heart disease, so yung mga sa puso. Merong hypertensive cardiopathy, pulmonary heart disease, and myocarditis. So, ang paliwanag po, pathogenesis. Yung pathogenic factors stagnate with the vessel, with black blood circulation. So, yun yung mga sanhi ng sakit, nandun po sa blood vessel natin. Kaya, hindi makadaloy ang dugo ng maayos. So, thus keeping the pulse slow and intermittent. Kaya, pag pitik po nun, pinipilit ng dugo natin na dumaloy dun sa veins. Pag nakadaloy siya, pipitik. Pag nabara na naman, hihinto. Siyempre, pipilit pa rin yung dugo natin dumaloy. Kaya ganun po yung nararamdaman, slow, irregular pulse. Then, if the Chi and blood sa Chi deficiency syndrome naman, ay deficiency syndrome, if the Chi and blood are not sufficient to fill the vessel, so kung kulang po yung dugo, hindi niya napupuno yung blood vessel natin, yung pathogen po pumapasok dun sa ating vessel. Yan. Siya po yung nandun, halimbawa yung cold, then encode the pulse to slow and miss beats irregularly. Pumapasok po dun sa mismong blood vessel natin. Remarks. In cases of congenital variation, this pulse could prove to be the normal pulse for some individuals. Kung may congenital variation daw po, is normal. So, clinical significance and its position, according to Li Shishen, nararamdaman natin ito sa prone position. Ito ay nagsasabi po na may deficiency and cold in the upper burner. So, alam na natin yung mga upper burner organ, Pag middle position, may pain from cold in the middle burner. Pag rear position naman po, backache and leg ache with feeling of heaviness from kidney deficiency. Yan, wala na naman sa amin. So, thank you for your attention.